All right. What are the two main actions of cortisol? I'll give you a couple of options. You've got increased blood glucose levels and fluid retention, increased blood glucose levels and diuresis, and decreased blood glucose levels and diuresis.
Increased blood glucose
And
what's the other one?
fluid retention.
No.
Sorry, I forgot the right answer.
Anti-inflammatory.
Yeah, and anti-inflammatory.
Yeah.
Good.
Primary function of cortisol is stress.
Yes. What would be the effect of decreased cortisol? Would it be increased blood pressure, decreased blood pressure, increased blood sugar levels, decreased blood sugar levels, or fluid retention?
Decreased blood sugar.
Good.
With what?
With a decrease in cortisol.
Oh, okay.
All right, let's go over Addison's disease. So, what is happening with Addison's disease? Like, what with my hormones? Are they high or
Addison's
low?
the exact opposite
They're
as
low.
Cushing's.
Good.
Yeah.
Right?
Yep. So you've got low ACTH. So what are some signs and symptoms that you're going to see with Addison's? What is their skin going to look like? Kind of weird for some reason. These people
Oh yeah,
start
that's
having
tan.
good. Yep, they call it the eternal tan.
Yeah.
And this doesn't resolve after they fix the Addison's disease. So that's why it's called the eternal tan, because as soon as they get it, it doesn't go away. I guess that's the one plus of Addison's disease. All right. And the reason that happens is because they have more melanocytes, so they just kind of like soak in all the melanocytes just are produced more and more and more, which pigment their skin.
I have low blood glucose.
Good. They could also have, like, women can start growing hair. They just kind of like grow hair in weird places. So they just, on the side this just says changes in distribution of body hair. So weird hair growth.
This is alopecia. Like there's decreased or no hair in pubic and axillary.
So it's just all kind of like, it says, like, I've heard that it could cause them to grow a mustache, but it could also kind of make it
Right here,
more
it says that
thin.
too. Well, she has a mustache there.
Oh yeah.
So I guess it just kind of depends on the patient. Like, these are just some things that could happen.
Weird. Weird.
So I guess what question could you guys ask your patient concerning, like, hair growth?
Have you noticed a change or something?
Good. Has your hair always been like this? Have you always had thin pubic hair? No. All right. Some other things. What are you going to expect with neuro? So they've got decreased stress hormones.
So they're going to be stressed.
With decreased stress hormones? Okay, so they're going to be apathetic.
Oh, that's what I meant. Because it says decreased resistance to stress.
They might be depressed. Or confusion.
Okay, wait. Okay, so here's his depression, apathy, confusion, and above it says decreased resistance to stress.
Decreased resistance to stress. That's kind of worded confusingly.
It is.
I would think that it's kind of like a decreased ability to respond to stress.
Okay.
That's a better way to put it. So, what are their aldosterone levels going to be like? Are going to look like?
Lower.
Good. So what are you going to look for with that, with low aldosterone? Good. So fluid loss, so they might have some weight loss. What about with electrolytes?
Low sodium, high potassium.
Perfect.